Leg strength in seniors is one of the most important things to help you stay active and function at your highest possible level. In this video, I'll share 4 exercises designed to strengthen your lower body, improve your balance, and instill a greater confidence in your mobility. Studies have shown that after 30 years of age, you'll start to lose between 5 and 10% of your strength per decade. This can be a scary thought, but the fact that you are here watching this video means that you want to do everything you can to offset this loss of strength. These exercises should take you about 15 to 20 minutes to complete. You'll want to do these 3 times a week with a day off in between if your muscles need it. Taking a day off is crucial when you get sore to allow your muscles to recover properly and build strength. These exercises can also easily be adapted to account for things such as arthritis, low back pain, or even a recent joint replacement surgery. And that's something that I get asked all the time. Yes, it is okay to strengthen even with pain or an injury. Before we get into strengthening, it's important to get a quick warm-up in. Go for a 10 to 15 minute walk or ride your bicycle or tricycle around the block. We're going to start off with a more basic exercise called the heel raise. The heel raise is going to strengthen the gastroc and the soleus muscles, which make up your calf muscles. They're important because they help with gait speed, power with walking, and balance. I'm going to show you 3 variations. The first one is just a simple heel raise. 2 feet together or close together. You're going to hold on to something if you want, and you're just going to raise up and lower back down nice and controlled. From the ground up and back down. You want to make sure when you do this, you don't arch your back. You want to just kind of ride the elevator straight up and lower down controlled. Do this about 10 times, but also base it on how challenging it is. And you want to feel that nice muscle burn, that fatigue. If you get it after 6 or 8 reps, stop there. But if it takes you 12 to 15, then keep going through. Next, we're going to do something called the deficit heel raise, the second variation. For this one, I'm going to grab a step. With the second variation, you want your heels to be able to drop below parallel. So you're going to start off the same, raising up, and then when you drop your feet down, you go right through level and drop into a deficit. You might even feel a little stretch in your calves when you do this. From there, go back up and lower back down. The third and hardest variation is a single leg heel raise. Just like the name implies, lift one foot up, holding on for support, raise up on your toe, and drop it down nice and controlled. There's a reason why I showed you 3 variations. In order to build strength, the exercise has to be challenging. If the first one, which you want to start off with, don't just skip around and go right to the second or the third. Start off with the first one. If it's challenging for you, stick there until it's not challenging. Might be a week or 2 before it becomes too easy. If it does become too easy, go to the second one. That's a little bit more challenging. Stay there until that one becomes too easy, and then you'll progress to the third variation. The second exercise is called sit to stand. It is exactly like the name implies. You're going to stand up from your chair and sit back down. Standing up and sitting down is one of the most fundamental functional activities we do, and it really works some key muscles in the thighs and the hips. First thing I want you to do is try and stand up and sit down without using your hands. If you can, great. If you can't, that's okay too. Setting yourself up for success by having good form is the key. First, you want to make sure that you're scooted out from the back of the chair. If you're sitting too deep in the chair, you're not going to be able to get your weight shifted enough to find your balance. So scoot out just a little bit. Make sure your heels are back underneath you a little bit, and make sure that your feet are about equidistant to your knees and or your hips. Standing up involves kind of a quick, powerful motion. And then when you sit back down, you want to go more controlled. First, you're going to hinge at the hips. Getting a nice hip hinge is important because you're not bending at the back, which is going to put you in a very weak position and possibly injure yourself. You want to hinge at the hips till you get your chest out over your feet. Ultimately, once your butt leaves the chair, your feet are the only thing supporting your weight. So to maintain your balance, you're gonna wanna get your body weight over your feet or your base of support. Practicing a couple nice hip hinges is kind of important. Once you feel like you're getting that weight shifted towards your heels, on that third try, go ahead and push through your heels and stand up. When you sit back down, same thing goes. You want to hinge at the hips, stick your rear end back, keeping your chest over your feet, lowering yourself down nice and slow. And if you maintain your balance, then you'll notice that you don't fall back into your chair. If you find yourself halfway through the sit falling back, it's probably not because you're not strong enough, but because you lost that balance. So every time you shift your weight forward to stand, when you stick your butt back, you also have to bring your chest forward. When it comes to how many sets and reps to do, it kind of depends on where your baseline is. You can say start off at 5 reps, and if that's challenging, stay right there. If it's not, go up to 10, maybe do 2 to 3 sets. I mentioned it's okay if you use your hands earlier, and that's fine. Just only use your hands what you need to help you get that nice smooth motion. If you use your hands too much, then you're going to be taking the opportunity to strengthen your legs away. You want to use the legs to power as much of the movement as possible. Third, we're going to do sidestepping. Sidestepping or lateral walking is something that very few of our patients do regularly, but it is very important. This exercise will work the hip abductors, and you should feel a good burn in the sides of your hips or even down your legs a little bit. These muscles also keep your pelvis level when you walk or when you stand on one foot, both functional activities. If you have weakness in the hip abductors, you may waddle a little bit when you walk, almost like a penguin. There's a technical name for this type of gait pattern, and it's called a Trendelenburg gait pattern, and it can lead to knee pain, hip pain, and a higher risk of falling. And it kind of looks like this. When you walk, you kind of drop. And what's actually happening there is that as your foot comes off the ground, it's the job of your hip abductors to keep your pelvis level. And if they're not strong enough, then they're going to let that other hip drop down. So when you walk and you pick up your foot and you fall right back down, that's called a Trendelenburg gait. And that's what this exercise is going to help avoid. So you're going to start off in a nice kind of crouched position, athletic position, a little bend in your knees and a little bend in your hips. And you're going to take slow, deliberate steps to the side, trying to keep your toes pointed forward. You don't want to drag the foot. A lot of people do that. You just want to kind of pick up your foot, put it across. Now, if that becomes too easy, what you can do is add a band. You've probably seen TheraBands, that latex band that you can tie. We have something called a hip core band. It's made by a company called Crossover Symmetry. We find these are a little bit tougher, work a little bit better, and we use them every day in the clinic, and they last years. You're going to go ahead and step into there. If you need to hold on to something, that's fine. And you're going to move this band up above your knees. Same setup, athletic position, driving to the side. And this band just adds a little resistance, makes it a little bit more challenging. I'm actually going to link to these in the description if you want to buy them for yourself. As far as sets and reps go, there's really no rule. It's to fatigue. It's so important that you push yourself until you feel that good muscle burn, and maybe a little bit even through that. If it starts turning into pain though, you've gone too far. And sometimes you won't really know if you pick the right dosage until the next day when you wake up. You should feel sore in those muscles the next day like you did something, but you shouldn't be so sore that you feel like you can't go out and actually function normally the following day. Lastly, are step-ups. You'll notice a trend with the 4 strengthening exercises I'm giving you. They are all functional. They help to strengthen our muscles for things that we do every day. The last one is no different. Step-ups are a great way to build strength in your quadriceps as well as improve your pelvic stability. You're going to need a set of stairs. If you don't have any steps available, you can pick up an adjustable step off of Amazon. I'll link to one that is affordable and has been tested in our clinics for durability. And what you want to do is get that whole foot on the stair. Some people make the mistake of only putting half of their foot on the step, And what that's gonna do is as you go to step up, it's gonna make you wanna fall backwards. So get that whole foot up. It also lets us push through our heels, which is where we wanna focus on as we generate the power. Just like the sit to stand, you wanna go kind of faster and more confident on the way up so that on the way down, you can go nice and controlled. You wanna get your weight over your foot, push confidently down and step up. On the way down, nice and slow. Think about having a carpenter's level, you know, the ones with a little bubble inside of them. I want you to think about having one right across the front of your hips. And as you step up, I want you to keep the level flat. Don't let it drop and then come back up. You're gonna give yourself hip problems and back problems. So you wanna keep it level as you go back up. That's actually gonna make you engage your core a little bit. So you're doing two things. You're getting your quadriceps and your hips and your core stability or pelvic stability out of this one. Same with the sit to stands. You wanna start off with maybe 5 reps, see how you feel, working your way up to 10 or 12 reps and 2 to 3 sets. Take a little break in between, let your muscles recover. Based on how you felt the next day, that's gonna tell you if you were good or if you need to do more or a little bit less by how sore you are. Make sure to check out this video for some more helpful exercises to improve balance and leg strength. Until next time.